Welcome everyone to Let's Talk Migraine, where we talk about some of the hottest topics faced by people who live with this disabling and complex neurological disorder that affects nearly 40 million people in the US alone and 1 billion globally. My name is Shoshana Lipson, and I want to give a special welcome to our patient advocate panel, Erin Atkinson, Marina Medved-Lentini from Parenting with Migraine, and Angel Pascal Carmen. All four of us live with migraine, but I do want to remind you that none of us are doctors. Nothing we say here should be taken as medical advice, and we can't answer any questions that are asking for medical advice either. We're only speaking from our own experience and want to encourage you to partner with your doctor in any medical decisions. Also, a special thank you to our sponsors, without whom we would not be able to offer this program, which is part of the Empowering Patient Voices project. And you can learn more about that on our website, Migraine Meanderings. Today, we're going to be talking about medical devices for migraine from the patient perspective. We're going to talk about the 5 different devices that are FDA cleared for migraine. But first of all, we're going to start off by talking about the Migraine Toolbox and why it's even important to have these devices in your toolbox. So let's start out with you, Angel. We often talk about having a migraine toolbox, but what does that term mean to you?
Thank you. A migraine toolbox is a combination of medication and non-medication that I utilize. I take it everywhere with me, so if an attack happens, I'll have those tools available to me so I can continue whatever I'm doing. It's also something that my husband holds on to. I have a smaller toolkit in my car. I have one everywhere, and it allows me to just be present.
Right, absolutely. What about you, Marina? What does the term migraine toolbox mean to you?
I would agree with Angel. It's a box, a box, not actual box, but there are different items of migraine relief items that I use: medications, balms, essential oils, migraine glasses. That I use to relieve my migraine attacks and the symptoms, and they help me function.
Right, absolutely. I think the only thing that I would add to that is, when I think about a toolbox in my mind, like I'm visualizing like literally a toolbox, that's got like a hammer and a wrench and nails and all these different things in it so that you can use different things for different, situations. So for me, that's what my migraine toolbox is like, is that I have different types of attacks. I have different things going on in my life which may impact the way that I want to treat an attack. And I have different concerns. So like you, Marina, I have medications, I have migraine devices. I also include lifestyle changes in my toolbox, or it could just mean lying down in a dark room and a green light and things like that. And Erin, we're going to get to you in a minute, but I want to jump back to you, Marina. Why is it important for you to have that toolbox? And maybe you could describe just some of the things that are in it.
Right. So it's important to have access to tools to manage migraine disease. Um, like you said, for different attacks, I have different types of tools. Sometimes I need to lay down and rest and access things like neuromodulation devices, and sometimes I am on the go and I need to grab something from my toolbox, like a medication or migraine glasses where I'm out and about with the kids. So it's important to have an array of different types of tools that I can grab depending on the situation I am in to help me function. For me, that's the goal, whether it's to abort my migraine attack or it's to minimize my symptoms. For me, the goal is to keep functioning so that I can be, the parent, the wife, the employee, and to keep going. So the toolbox helps me function, keep going. It helps me live and manage my migraine disease.
Yeah, that makes total sense. What about you, Erin? What does your toolbox look like for migraine, and why is it important for you to have that?
Well, like all of us here, I'm also a parent, and when I have an attack where I need to be present, I can't lay down, then I have to make sure that I am using something that's not going to make me sleepy. So I'll go for my neuromodulation device, and sometimes we'll skip the medication because I can't use the medication if it's going to make me sleepy. I've also got something for nausea in there, if I have nausea with an attack. Migraine glasses, I've got probably a dozen pair of sunglasses just kind of in both my vehicles, and kind of most commonly, common places in my home. Sometimes I lose them, so I have extra ones. It's it's important to have that, because oftentimes we have that sensitivity to light. So that's kind of a handful of things I've got in my toolbox.
Yeah, absolutely. That makes total sense. All right, we're going to show you what some of these devices look like. There are 5 that are FDA cleared for migraine indication. And when we talk about FDA clearance, this is what would happen with a device. So for medication, talk about FDA approval. With devices, we talk about FDA clearance. That is different than a device that is FDA registered. If it's FDA registered, that just means that it's allowed to be used in the US for something. It doesn't mean that it's gone through any clinical trials and gone through that official clearance for a specific indication. So that's why I just want to clarify that. It's really important, because we all know, as people with migraine, we get bombarded with spam and adverts to try this, to try that, different things. Lo and behold, 100% of people get 100% relief instantaneously. And most of it is not true. So it's really important to know which devices are actually FDA cleared, which means they have gone through extensive clinical trials that are double blind and can be repeated. So this is really important. There are 5 devices that are FDA cleared. We have examples of 4 of them here. So I'm going to show you them really quickly, starting with the Cephally. So this is the Cephally. And some of the other people on the panel have these devices as well, so they'll show them when they talk. So the Cephally goes up here on your forehead, and it stimulates the trigeminal nerve, stimulates and then calms it down. It is for preventive and for acute treatment, and it is for 18 plus. So we'll talk a little bit more about that device in a little bit. Then we have the GammaCore, which I have here. This one actually goes on the side of your neck. It stimulates the vagus nerve. It's called a non-invasive vagus nerve stimulator. It is also FDA cleared for acute treatment and preventive treatment. It is also cleared for cluster headaches. There was 2 specific indications. You can learn more on their website, and we can put the links up to the websites in the comments. This device is approved for 12 plus. So that's adolescents and adults. And that's really important. We're going to get to that in a little bit as well. Then the next device, this is not in any particular order. I'm literally just doing it alphabetically. This is the Nerivio device. This is the armband that you use with the Nerivio device. This actually goes on your arm here. And this one is for acute and preventive treatment. It is also FDA cleared for 12 plus. So that means adolescents and adults. It's called a remote electrical neuromodulation device. It stimulates the peripheral nerves, which then signal the brain to treat the pain of the migraine. Just to remind you, we're not doctors, we're not scientists, so we're not going to get into the details of how each of these devices work. I see Marina is actually showing you how that goes on, so thank you so much, Marina. But you can go to their website so you can learn more about it. I was going to say, the nice thing about the Nerivio is if you put it high enough up on your arm, you can actually put your sleeve over it. So you can wear that during a meeting, you can wear it while you're out and about, and nobody even knows that you have that on. The 4th device is the Relivion MG. So if you have this, it may look a little bit different because you may have a nasal thing here that actually supports it on your nose. I don't like it because it triggers pain for me. So you put it around your head like this. This device stimulates the trigeminal and the occipital nerve. It's called a brain neuromodulation device, and it is FDA cleared for acute treatment, but it is also in clinical trials for preventive treatment. And if you get this device on the app, you do have the option to try it for preventive treatment as long as your doctor has prescribed it in that way, which would be an off-label prescription, but some people are doing that. So just to let you know. And then the 5th device, which we do not have an example of, is called the Savvy Dual. The Savvy Dual is a single pulse transcranial magnetic stimulation device, STMS. And that generates a magnetic pulse, affects the electrical signaling in the brain, which also, by the way, the Relivion MG also affects the electrical signaling in the brain. That device is about this size, and it goes on the back of your head. And again, we have links to all of these devices in our comments. We will go over the pricing for these shortly, but I just want to get back to our questions and our panelists right now to talk a little bit more about these devices and our experiences with them. So we're going to jump into you, Aaron. So which of these devices have you tried, and is it helpful to you?
Well, I've only had the opportunity to try the Nerivio. I've got my nice little Nerivio here, and comes with a nice little pouch, which keeps everything together. Good, because I lose things sometimes. And for me, it's been very helpful, more effective than pharmaceuticals, and it doesn't have any of the side effects of pharmaceuticals. On the app, it comes with a nice little meditative video and audio that you can kind of listen to. It just kind of calms you down, and it's been great. I've used it since it came out. I think, what was it, 2019, I believe. It's just been one of the best things that I've had, because I get side effects from medication, and sometimes those are harder to manage than the actual migraine attacks. So using this, really helps out.
Absolutely. That's great to hear. I'm so glad that helps you. What about you, Angel? Which of these devices have you tried, and have they been helpful to you?
I have used all but the last two devices that you shared with us. I've had different levels of success. I think it's because, like many of us, we have various different types of migraine diagnosis. And so depending on the attack has depended on which device I've had more success with. But one of the things that Aaron touched on that I found, especially with the Gamma Core, is when I was having anxiety, having the device on my vagus nerve actually also helped with that. And I know, being a part of a clinical trial, that was one thing that they were looking at. And so I think that having as many of the tools that you're able to assess helps just dealing with whatever migraine attack that you're dealing with.
Absolutely. I totally agree with that. And what about you, Marina? By the way, Marina, thank you so much for doing this today. I know you jumped in the last minute, and I know you're not feeling good. It's that dreaded migraine that kind of always comes at the worst of times. So thank you so much for doing this and for pushing through. So which of the devices have you tried, and are they helpful to you?
Is anybody else having a migraine
with me now, yes.
Angel? Yes, so I've tried many of the devices, and I do think it's important to, I think somebody touched up on it already, that we're all so different. And just because some of the devices work for us or don't work for us doesn't mean that they will or will not work for people in the audience. I think different devices work for different types of attacks, and everybody has to try it on their own. So the device that works best for me for acute attacks is Cephally. I actually have been using it for years now, and it works best when I take a rest. So I know some people, can work with it but I need to, when I have a migraine attack, I need to lay down, and if I can actually take a nap during it, it has a better success of working. And right now I will be trying Nerivio preventively. So I'll let everybody know how it goes at some point. But those are the two right now that I am having success with and will be trying out. But again, I think everybody needs to try it out on their own, because you just never know. This could be the device that, will help you.
Yeah, absolutely. That's so true. So I often have people ask me, hey, what works for you? It's kind of like, what works for me is going to work for you. And that's just not true. It may work for me. It may work for Aaron, Angel, and Marina, and it just may not work for you. It could be something that doesn't help us that helps you. So it's the same as with medications. We're all different in how we respond. And that's the same with the devices. So I would, highly suggest talk to your doctor about a migraine device if you haven't already, or if you have tried one, talk to them about another device. And if it's okay for you to try it, give it a try. What do you have to lose? So for myself, I've tried all of them except for the last one. I have not tried the Savvy Dual. So the Gamma Core, unfortunately, did not help me. With the devices, I tend to be really kind of like emotionally pushy. And by that, I mean, I try to think positively, which I know is not migraine works, but it's like, I'm really, really going to make this thing work. And so a lot of them I'll try again and again and again. I had the same perspective with medications. I'll try it. and then try it again. I just don't want to admit failure. Unfortunately, the gamma cord did not help me either preventively or to stop attacks. But I know people that it has literally been life changing with, which is amazing. I mean, that's like everybody's dream. Then I have also tried the Relivium, which goes around your head. I've actually tried that preventively and abortively. I had to stop using it preventively. Unfortunately, I have a very, very sensitive skin, and so it just didn't work. And I have very high levels of allodynia. A lot of us have allodynia, and there is a protocol for both the Cephally and the Relivium to help overcome that. And with some people, it will help. With me, unfortunately, it didn't. I did use it for acute treatment, and it did help stop a migraine attack. So that was really important to know that, to discover something that does that is really amazing. Obviously, you can't really walk around on the streets or anything else while you're wearing it. People will think you're bizarre. But if you're at home or if you're in bed, then, it's a great option to try. Then the Nerivio is the one that I use the most often. I love the fact that I can go to a conference, or I could even be sitting here and wearing it and using it, and no one would know that I have it on. It does not help me preventively, at least as far as I've tried. I haven't 100% given up, but it does often stop an attack if I start treatment within 20 minutes. So that's less than what they recommend. They say like within the first hour, but for me, it's within 20 minutes, and it's within the first symptoms. So my first symptoms are normally nausea, and my heart starts to race. So before the pain even starts, if I can do that, then it often will stop an attack. Sometimes, depending on how bad the attack is, I'll double it up with medication, and then it stops, and who knows which it is that worked. But, every attack it stops is a win-win. And then the Cephally, for me, I had the same issue with allodynia. So I did try it, really tried it again, and it didn't help me. But again, like Marina, that's a great device for her. And I know people who love the Cephally device. And it's also important to note the Cephally is the only device that is not prescription. So that means you can just get it over the counter. All the other devices you have to get a doctor's prescription for. I do see that we've got a lot of different questions coming in. And so someone asked, do you need a prescription for the Nerivio? Yes, you need a prescription for the Nerivio, for the Gamma Core, for Relivium MG, and for the Savvy Dual. But if you don't have a headache doctor who's willing to prescribe it to you, these companies do have telehealth options. And you could also try NeuroHealth, which will prescribe any of these devices for you as well. So there's different ways of getting it. And I see any of these devices approved for specific types of migraine. You can go to their website and you can look more into depth in that, but I know for a fact that the Nerivio is approved for both chronic and episodic migraine. I will say that the division between chronic and episodic is kind of nebulous. Is there really a lot of difference between having a migraine attack on 14 days of the month or 15 days of the month? And a lot of headache specialists discuss this as well. It's kind of nebulous. So if you have migraine, your doctor approves it, give these devices a try. I'm going to get to more of the questions in a little bit, but I'm going to jump back into you, Angel, right now. And the question is, do you use a migraine device for all of your attacks or just for certain attacks? And then how do you decide that?
I would say for some attacks. The differentiation will be because I've just recently started using this device, the surfing. And I'm sorry, my speech is messing up with my migraine, so I'm saying it incorrectly. But I've just recently started using that. And like Marina said, I can't walk around with the device on my head. So this isn't one that I can use. The original, when I'm out, I have that in my pack. I can. So it really depends on where I'm at when I have the attack. But what I do try to do is, because medication is, whether it's rebound or is dealing with a shortage of how many you get prescribed a month, I try and stretch out my medication by using the non-medical devices. And that's literally how I started to utilize this in my toolkit.
Yeah, absolutely. That's really helpful to know that. And like, I just said that for my attacks as well.
Can I jump in with a little tip for the Cephally?
Absolutely, you can.
For anybody who uses Cephally and finds that these strips peel, too easily, I love these little, it's backwards. They are pre-tense prep wipes. Obsessed with them. They are little wipes that come in like a little patch, and you just wipe your forehead and it's kind of like an alcohol swab, and the stickies stick so well. I mean, you can do headstands with it. It will not fall off. I
I'll
just
try
wanted to
that.
say that for people because I know many have an issue with the stickies peeling off. They were actually recommended by the Cephally team.
Yeah, that's really helpful. Thank you for letting us know. I didn't know that. And one thing I should add about the Cephally is if you have super sensitive skin, we're not talking about allodynia, but if you're liable to have like rashes and things, they actually have pads that are specifically for sensitive skin. So don't be afraid to ask for that. You will need to order those separately. And Marina says that she has them as well. I am going to answer this.
Too.
You do as well? There you go. Now, these devices, all of them except for the Relivion MG, are FDA cleared for both preventive and for acute treatment. But that doesn't mean that we all necessarily use them for both. So Marina, do you use your device for preventive treatment, abortive, or both?
Right. So I think I kind of touched up on it already. So the Cephally I use as an acute treatment. And the reason I chose not to use it as a preventive treatment is that I don't love the sensation of Cephally. And I think many people do enjoy it. The many people I've talked to on my platform actually love the relaxing sensation and they describe it as a massage of their head. I don't enjoy it. And so I personally use it. I feel like my head and face is just too sensitive for it. So I use it as an acute and I didn't want to use it as an additional time to use it every day as a preventive. So that was my personal choice to use it as an acute. But I will be using Neurivio as a preventive because it's on my arm and I feel like it's not as invasive for my face. And I think we all have to make our own decisions which treatment we want to use for which purpose, right? And it's wonderful that all of these devices have the option, right, to be used for different purposes and for both purposes.
Absolutely. And I think that's a great example of, why it may be that you don't want just one device. You may want 2 devices in your toolbox. You may want 3 devices, so that you can treat them all differently. I'm just going to remind you that for some people, you cannot use these devices. For example, if you have an invasive medical device in your body, like a nerve stimulator that is implanted in your body, the chances are you are not going to be able to use these devices. So it's really important to talk to your doctor. If you have a heart problem, if you have epilepsy, if you're pregnant, it's not that these are necessarily contraindicated, but talk to your doctor to make sure that what you're doing is safe. It's really, really important to do that. Erin, let's talk about using the device by itself or using it together with medication or other tools from your toolbox.
I use my device. It depends on my responsibilities for the day. So generally, I will use it if I'm home with an attack. I'll use my Neurivio with like an antihistamine, but it makes me sleepy. So that's one of the medications that has the least side effects for me. So I'll pair those together because a lot of times I can't fall asleep and I can't relax. So the antihistamine helps. If I have obligations where I have to be driving or more present, if I've got my kids and I have to do all the parenting stuff, then I don't have the luxury of laying down for very long. So I use it separately, by itself. I did want to touch on you had mentioned the devices when you have something implanted. I know that for women that are on birth control that have the implant, you have to be careful with the Neurivio because it can react to the implant in your arm too. Just wanted to throw that out there.
No, absolutely. And the Neurivio you can wear on both arms, right? On either arm. So make sure, like Erin says, make sure you talk to your doctor. And if you have an implant, whether it's the nerve stimulator or, the birth control device that's implanted, talk to your doctor, please, before you use these devices. It's really important, especially if your doctor doesn't know much about it and you go on to telehealth and you're not telling them your whole health history. You can learn a lot also from each of these devices' websites. They go into a lot of details. So I encourage you to check it out and learn the information. Let's go to you, Angel, and let's talk about how did you get your device or your devices? What was that process like and what might it look like for people?
In full transparency, for the gammaCore, I was a part of a clinical trial. And so I was able to test that device out. For the other two, I went to my neurologist and I asked about it. And unfortunately, she was not aware of the device. And so I utilized the resources for each of the companies that had the telemedicine. It was a very, it was a small fee. It's nominal to everyone. I believe it was like $49 for Naruto, and and the other one I didn't need it, but called in, did the questionnaire, and was able to, because everyone is different in this economic world that we are. The one thing I did enjoy about this device is that I was able to do a payment plan to pay for it, and I think it was like 4 payments of something I don't remember, but that took away some of the ouch of a cost.
Right.
Is trying to find a way to pay for it. And so
Yeah.
the process was very easy, really, for the two that I didn't get part of a clinical trial.
I love the fact that you use that term, the kind of the out of the cost, because part of the challenges of these devices is that most of them are not covered by insurance. They are all working on it. And there are some people who are able to get them covered, but in general, insurance companies do not like to cover these medical devices, which is really frustrating. They call them experimental, which they are not, because they've gone through clinical trials and got that FDA clearance. And that is something as patient advocates we are trying to work to change, as well as the companies. But it's just a long process. But you know what? It never harms to fight. If you like being a squeaky wheel and you got the energy, fight and talk to your insurance company and see if you can get that approved. Otherwise, it is kind of an out for these devices. The way I look at it is, if this stops one migraine attack, which for me could last multiple days, then that's multiple days I'm able to do something else. I may be able to earn money. I may be able to write an article. I may be able to, get online and do an event with you. And so I have to balance off, the benefit versus the cost. And so each of us have to do that separately. If you're working full time and your migraine attacks are out of control and there's a device that's expensive, but it stops your migraine attacks, well, the cost benefit may be there for you. So it's important for us each to evaluate that individually because we're all in a different place. And a lot of us have fixed incomes. So no one can tell you, if it really works, you absolutely would pay for it, because that's not necessarily true. But it's important for you to sit down and evaluate the cost benefit of that as well. So what about you, Marina?
Well, before you move on, I do want to, today is Veterans Day, and I want to make it aware that if you are a veteran, at least the gammaCore, the veterans, you can get that through the Veterans Administration. They are really working to help, because I believe with gammaCore, there's also some helping with migraine and PTSD that impacts migraine. So if you are a veteran, please reach out to the Veterans Administration and see if you would qualify to get it, and you would get it at no cost or a very low cost. And that was one of the things that I was able to learn with the gammaCore for sure.
Absolutely. And thank you for reminding us of that, Angel. I appreciate that. Yes, today is Veterans Day. If you're a veteran or if you're an active service, thank you for your service. We really appreciate everything that you do for our country. And just to reiterate what Angel says is that most of these companies work directly with the VA. And a lot of time you can get these devices for free. gammaCore works with them extensively. And like Angel said, not only for migraine, but also for PTSD and some other things as well. I know that Relivion has been working with the VA as well, the Relivion MG. I believe Nerivio is also, or the company is Theranica. I don't know about the other ones, but it's definitely worth checking out. If you're a veteran, or you're in service, then check these out and see if you can access these devices for free. That's really important. So thank you for that reminder. Marina, how did you get these devices? Was it an easy process? What was it like for you?
Well, so I just got Nerivio literally a week ago, and they gave me an option whether I get a prescription through my own headache specialist or I get a prescription through them. And I love, like Angel said, that you can get, if you don't want to go through your headache specialist and go through that trouble, you can use these, online services through these brands, which most of them, I believe, offer. And it is a nominal fee. I think I used Relivion right? And I think it was $30 to pay to go through their physician, to get the prescription, because I didn't want to wait or deal with going through my doctor. But this time with Nerivio, I went through my doctor because I use NeuroHealth, and I just sent them a message through the portal, how fast they are, and they sent me a prescription directly to Nerivio, and they just did their thing. And all I got was a message from Nerivio via text, and they sent me a device, and I think the first device was $49. So there are definitely options available to help you guys afford these devices.
Yes, there really are. And before I get to you, Erin, I haven't forgotten about you, but let's go over those prices really quickly. And that is like right now, just going through it alphabetically again, Cephaly, they have a 15% Veterans Day sale. So today is a great day to go and buy it, or you can wait till Black Friday and see if it goes even lower. I don't know if it will go lower, but that's up to you. So they have 3 different prices. $331 for their standard Cephaly, which is the one that I have here. It's not their connected Cephaly, which actually works through an app, which is pretty amazing, but it's their earlier one. $360 for the connected Cephaly, and then $447 for the connected Cephaly that's bundled up with a whole load of different pads and sticky things. I'm not even sure what you would call those, but it's a bundle package. So it starts at $331, goes up to $447. That is with the 15% off for the Cephaly. Again, that's a 90-day return policy. So you can try it. If it doesn't help you, you can send it back and get your money back. The Gamma Core is approximately somewhere between $200 to $300 per month. They do not list their pricing on their website, but this is my understanding from the company. $200 to $300 for a 3-month trial. You don't get your money back if you don't like it, but you're not spending any more money than that. And then somewhere between $150 and $200 per month thereafter. I apologize if that pricing isn't 100% accurate. That is the closest I could get to it from my information, but between $150 to $200 per month is my understanding on an ongoing basis. The Nerivio, $49 for the first device. Up until about a year ago, you could actually get it for $10. So if you missed that, join my group so you don't miss opportunities like that. I was telling everybody, get the device. It's $10. Why would you not want to get this device? So now it's $49, which is still, very reasonable. And then $89 there afterwards. You can refill it directly from your phone. It works via an app. It has 18 treatments. For a preventive treatment, it's every other day. So you could use it preventively and still have some treatments left over to treat it on an acute basis. Then the Relivion, that is $200 for a 3-month trial. Again, you do not get your money back if you don't like it, but what that does is enables you to really give it a good try. And then after that, they say as low as $75 per month. And they have different plans, is my understanding. So it depends on which plan you actually go on. And then the Savvy Dual is a flat $395 per month. So that kind of gives you the range of the pricing. So you can kind of make a decision about that. But again, you may find that the cheapest device doesn't work for you. It's the most expensive device that works for you, or vice versa. Or you may need more than one device. So if your doctor says yes and you had the finances, we definitely encourage you to give these a try. So Erin, let's talk to you about how did you get your device and what was that process like?
Well, I got my device when I came across an article about the Nerivio getting approved. I think it was on Time Magazine as like one of the the top numbered devices that was coming out, and so I messaged my neurologist through the portal. I said, "Hey, have you heard of this? I want to try it out." He had no idea what I was talking about. I sent links from the information that I had found and sent it to the neurology, and they got me a prescription for it. I paid for all of mine. I was fortunate enough to get the $10 special in the beginning, so that was great. I was kind of hit with the sticker shock when it went up to the $89, but I understand because it used to be 12 treatments, now it's 18, so the cost, it's understandable. But yeah, it was it took me close to a month to get it in my hands after emailing my neurology, but that was a pretty quick turnaround considering it was a new device and
Right.
having to jump through the hoops of providing the information.
Right.
But my neurologist knows my journey that I've gone through of trying so many different things. He's like, yeah, let's try this too.
Right.
So they were very open to helping me get that.
Yeah, I love that. Yeah, and just kind of a quick note for people that, sometimes I see comments about why are these devices so expensive? These companies are taking advantage of patients. And I think it's always good to kind of pause and think, well, one pill of a new medication may cost over $100 just for one pill. I use a nasal spray that, not a new one, not the new one, but an older one that costs well over $100 every time I use it. So if you kind of compare it to some of the medications that we use, these are really very affordable. And it's in none of our interest that these companies go out of business. So just need to bear in mind, one of the companies actually did go bankrupt for a while. And so we don't want them to go bankrupt. So just kind of want to kind of set our expectations, appropriately. It's very, very expensive to create these devices, to do the research, to get them cleared by the FDA. But again, I understand that some people just can't afford them. And that's really frustrating. I do see a question here about Medicare, Medicaid. Medicare, Medicaid does not cover these devices right now. Again, we are trying to get them covered. It just makes financial sense from an insurance perspective. If you have a prescription that's $1,000 for medication, and then you have a device that is $200 a month, this is just a no-brainer. And so that's kind of the approach that we're trying to take with insurance companies, among other things. But right now, it's just an uphill battle. At some point, it is going to change, but it has not changed right now. I would say that for my devices, I always had to go through my doctor to get the prescription. The neurologist that I used to see before I started seeing someone at NeuroHealth did not know anything about all these devices. So I printed off the prescription form from their websites. We also have some of the prescription forms on the Migraine Meanderings website. If you go to migrainemeanderings.com/devices, you can get some of those forms, or you can go to the company's websites. I take it into him, I fill it out, everything I could fill out, and then just have him sign it and put all his prescription stuff in, and he would send it off. Now with NeuroHealth, it's super, super helpful and super, super easy. You just tell whichever doctor or PA that you're working with, I'd like to try this device. If they approve it, they take care of it. Just really, really easy process to get these devices. My insurance has not covered any of these devices, but I'm on Medicare, so I'm not surprised. But I am someone who periodically has enough energy to be a squeaky wheel. And so I'm certainly willing to start fighting for that and pushing to try to get them covered. So we're going to be closing out with a final thought from each of us. And I'm going to start with you, Angel. And the question is, why is it important for you to have a migraine device in your toolbox?
There's so many reasons, but I'll be really brief in saying that at the end of every day, I want to be present. And however way I can be present, I am willing to try every single thing under the market, and not always it be something I've been ingesting in my body. And so for me, having this with me, and the fact I can throw this in my bag, that I have it on hand, that my husband knows how, when my migraine is so bad, to get it started on with the app. My version has the app, allows me to be present.
I love that. That's wonderful. What about you, Aaron? Why is it important for you to have a migraine device in your toolbox?
Well, as somebody who has a lot of the fine print side effects from medication, having the device is one of my first lines of defense, because I need to minimize any side effects, because those, as we all know, they can roll over into other issues and create, rebound headaches, and you get stuck in the whole cycle. So if I can stop it with the device and not have to touch any of the other stuff, that's a win for me.
What about you, Marina?
Yeah, so for me, it would be it's important to have a neuromodulation device to limit the amount of medications I take, because I'm very susceptible to rebound headaches. Um, I have been in a rebound headache cycle many times during my migraine journey, and it has been very difficult to get out of it. So the more I can use items in my migraine toolbox without medication, or medications that do not cause rebound headaches, the easier it is, for me to stay without rebound headaches.
Love that. Thank you for sharing that. For me, I would say that, like many people with migraine, I have limited amounts of medication. So having a migraine device helps, spread out my need for that medication, helps it last. But most importantly for me, besides that and avoiding side effects of medications every time I get an attack, every attack that a migraine device stops is a win-win. It gives me back my life. And that's especially true because many of my attacks will literally last for days or even weeks. And so if I can stop an attack before it goes any further, it literally is giving me my life back. So thank you, everybody who's been watching us today. Thank you, Aaron, Angel, and Marina for joining us. I really appreciate you coming on here today and talking about migraine devices. And we just want to encourage everybody to, again, partner with your doctor if you live with migraine or if a loved one lives with migraine. We know that the impact of this disease can be huge. So explore different treatment options. Check out the Migraine Toolbox on our website. And remember to talk to your doctor about how much migraine is impacting your life. Most of all, connect with others who understand so that you can get the support you need. Have a great day and goodbye.